Oxaliplatin is a moderately emetogenic chemotherapy, and in the standard guidelines, the program that was used, including Aprepitant, is not part of the standard guidelines. In the standard guidelines, it would be a 5-HT3 receptor antagonist, preferably palonosetron, because there is an effect on delayed nausea and vomiting, which seems to be better than the standard ones, with dexamethasone. So it's a little bit unusual to have that type of scheme used in this type of patient. The results obviously are quite good, but also the comparator results are better than what you would expect normally, meaning essentially that oxaliplatin is a moderately emetogenic drug and not very in that group, not very highly. There is a difference in results between women and men, but that's always the case. In most studies, women are more affected by side effects, emetogenic side effects of chemotherapy, for many reasons which are not always very clear. Cachexia is a very frequent problem, and it is a major problem for the subjective feeling of the patient. There are many different variants of clinical manifestations of cachexia. What is interesting is that there are a few new drugs. One of them, the drugs that has been the hype over the past couple of years, is anamorelin, where there have been two larger studies in lung cancer done, and you can show that there is a gain in general feeling, in weight, but there is no improvement in survival by treating cachexia so far. I think the perspective is with this new drug that studies have been done in some limited situations, so it will be probably used much more generally, and it will be interesting to see what the position of the drug will be in a couple of years. Hepatitis C is a major problem because patients get cirrhosis and then hepatocellular carcinoma as a complication from hepatitis C. And hepatitis C has been very fashionable over the past few years because there is an excellent treatment where the drug available gives you something like 90% of improvement or healing of the situation. And it is hoped that you could decrease the incidence of cirrhosis and hepatocellular carcinoma. Unfortunately, as of now, there is no vaccination for hepatitis C, but we have now two very good drugs available which are easy to take. It's one pill per day. The problem as of now is the cost. The cost varies somewhere, depending on the countries, between $35,000 and $75,000 or $80,000 for an 84-day treatment, which means that at the extreme it would be $1,000 per pill or 500, depending on what the type of country is. There's one thing which is important in this whole issue, that from the medical point of view, you have excellent results, and in some diseases you have to treat preventively. If patients are positive in lymphoma, for instance, you have to treat the hepatitis C at the same time, otherwise you run into problems. And the other thing is that the company, and that has to be said, that produces the drug has given free patent to some 60 so-called third world countries so that they can get the drug to a much cheaper price.